Hello, and welcome to this presentation on the FEP Medicare Prescription Drug Program, brought to you by the Blue Cross and Blue Shield Federal Employee Program. The FEP Medicare Prescription Drug Program, or MPDP, is a prescription drug benefit exclusively for Blue Cross and Blue Shield Federal Employee Program, or FEP, members with Medicare Part A and/or Part B. It's included as part of your Blue Cross and Blue Shield Service Benefit Plan coverage. You are eligible for MPDP if you are an FEP member, enrolled in Medicare Part A and/or Part B, and are a resident of the U.S. or a U.S. territory. With MPDP, you continue to receive the same FEP health plan benefits you're used to now. Have additional approved prescription drugs in some tiers than you do with your current pharmacy benefits. Get lower out-of-pocket costs for higher-cost drugs. Have a cap on the amount you pay out-of-pocket on prescriptions annually. And don't pay a separate premium for your prescription drug coverage. MPDP has 4 drug tiers across all 3 of our products. Note that these tiers are different from the traditional FEP pharmacy benefit. Tier 1 are generics. Tier 2 are preferred brand name drugs. Tier 3 are non-preferred brand name drugs. And Tier 4 are specialty drugs. The amount you pay for a drug depends on the tier. In general, the lower the drug tier, the less you pay. With MPDP, you can order prescriptions and refills at one of our 65,000 plus in-network retail pharmacies, or through the FEP Mail Service Pharmacy Program. This is for basic option and standard option members only. MPDP has a larger network than the traditional FEP pharmacy benefit. With MPDP, specialty drugs are Tier 4 drugs. Depending on how the drug is dispensed, you can buy specialty drugs via retail pharmacies or mail service. You do not need to fill these drugs through the FEP Specialty Pharmacy Program. You might be wondering what you'll pay for MPDP. This benefit is included as part of your current FEP premium, meaning there's no extra cost for it. You will pay your FEP premium plus your Medicare Part B premium if you have Part B, as you do now. You can use the FEP Prescription Drug Cost tool during open season to look up your specific drugs and how much they will cost at local pharmacies, and through the FEP Mail Service Pharmacy. You can also compare the cost to your current FEP prescription drug benefits. To use the drug cost tool or to download the full formulary for your plan, visit fepblue.org/MedicareRx. Let's take a closer look at what you'll pay for specific drugs for each plan. Here's what you'll pay when you visit an in-network retail pharmacy with FEP Blue Focus. Note that the FEP Mail Service Pharmacy is not a benefit with FEP Blue Focus. Here's what you'll pay when you visit an in-network retail pharmacy with basic option. Here's what you'll pay for the FEP Mail Service Pharmacy with basic option. With FEP Mail Service, you get up to a 90-day fill of each of your prescriptions. Here's what you'll pay when you visit an in-network retail pharmacy with standard option. Here's what you'll pay for the FEP Mail Service Pharmacy with standard option for up to a 90-day supply. A unique benefit of MPDP is that you have an annual pharmacy out-of-pocket maximum. An out-of-pocket maximum is a cap, or maximum, on the amount you'll pay for your health care costs. In the case of MPDP, it's a cap on the amount you'll pay for prescription drugs for the year. Once you reach the maximum for the year, you pay nothing out of pocket for your prescriptions for the rest of the year. What about your overall medical out-of-pocket maximum? You still have one, but your MPDP pharmacy out-of-pocket maximum is part of it, not added to it. Here's the annual pharmacy out-of-pocket maximum for each plan. Now let's see an example of how the out-of-pocket maximum works. I Wanna Be Blue is a basic option member who currently does not have MPDP. They take 3 generics, 3 preferred brand name drugs and 2 specialty drugs that they refill monthly at a local in-network retail pharmacy. Their annual out-of-pocket maximum is $6,500. Here's a closer look at I Wanna's out-of-pocket costs for the year. They have to pay the full $4,560 because they haven't hit the $6,500 out-of-pocket maximum. Now, let's say I want to decides to enroll in MPDP in 2024. This includes the $3,250 out-of-pocket maximum for basic option members. Here's how their out-of-pocket costs change. First, Iwana does have lower cost shares for some of their prescriptions with MPDP. And even though Iwana's total is $3,780 for the year, they will only pay $3,250 due to the out-of-pocket maximum. This means, compared to what Iwana is paying now, they will save over $1,300 with the new MPDP prescription benefit. With MPDP, you get access to the Medication Therapy Management Program. If you have complex prescription drug needs, this program is available to you to get support from a pharmacist. They'll help ensure you get the most out of your current drug therapy by providing different resources you can use. Now let's talk about MPDP enrollment. If you have Medicare Part A and Part B primary, are not enrolled in a Medicare Advantage, or MA, plan, and do not have Medicare because of end-stage renal disease, or ESRD, we will automatically enroll you in MPDP. This automatic enrollment process will begin in October 2023. If you're in the automatic enrollment and want MPDP, you don't have to do anything. We will send you a letter outlining the process and you do not need to respond. We'll also send you a new member ID card before your coverage begins on January 1, 2024. However, if you don't want us to automatically enroll you, and you want to keep your current FEP prescription drug benefits, you need to let us know. The eligibility letter will provide you with instructions on how to opt out of MPDP by mail or phone. Once you receive the letter, you'll have 26 days to let us know you want to opt out. If we don't hear from you within those 26 days, you'll be enrolled in the benefit. Don't worry if you miss the deadline. Once you're enrolled, you can tell us at any point that you want to go back to the regular FEP prescription drug benefits instead of MPDP. You can call 1-800-MEDICARE or mail us at P.O. Box 3539, Scranton, PA 18505. If you're a member who meets the eligibility criteria for MPDP but you do not meet the criteria for automatic enrollment, you can still enroll. You will need to submit the voluntary enrollment form to enroll any time on or after November 13, 2023. You can download the enrollment form at fepblue.org/MedicareRx. Please make sure you download the correct form for the plan you're enrolled in, FEP Blue Focus, Basic Option or Standard Option. Once you have the correct form, you'll need to call the customer service number on the back of your member ID card to complete it. To learn more about the FEP Medicare Prescription Drug Program, call 1-888-338-7737, TTY 711. You can also visit fepblue.org/MedicareRx for more details. You can also scan this code with your phone's camera to view an interactive version of the FEP Medicare Prescription Drug Program booklet. Thank you for taking the time to learn about the FEP Medicare Prescription Drug Program. Don't forget to follow at FEP Blue for the latest benefit updates and healthy living tips.